I first had the symptoms in 2013. I'd touch my chin or my top lip and I'd feel a slight tingling, like a mild electric shock. It was a few minutes of pain a few times a year, but by the end of 2017 I just didn't have a life. I couldn't really speak to anybody, and then as we progressed towards the operation it was just worse and worse and worse. 24 hours of pain, more or less.
Jeffrey Axe is a patient who's very well known to me. I remember meeting him very, very clearly. He came to see me, we had a consultation, and the dialogue was constantly interrupted by very acute, severe spasms of pain into his face, where he had to stop talking and just pause for a while the pain just subsided, and then he would say a few more words and he'd have to stop again, and he was clearly in absolute agony with his pain.
The two pains were someone sticking a knife in your head and twisting it, and the other one was like the worst headache, migraine, hangover you've ever had. Compress it into a very small area and put it there. It was bad enough so I couldn't sleep at night. It become very isolated, and I was beginning to understand why they called it the suicide pain.
He never used to socialise, he didn't eat the food he wanted to eat, he wouldn't even go out in cold, windy weather for fear of the pain being made much worse. So it really impacted upon every aspect of his life.
I went to the doctors who diagnosed trigeminal neuralgia, which was a bit of a shock, but I didn't know how bad mine was until I got the results of the scan and saw two snakes wrestling each other in my brain, basically. And he explained the pros and cons of each solution, and MVD just stood out as the one to go for. I was actually looking forward to what could be termed a serious operation. Even after he'd explained all the risks, the percentage chances of those were so low, I thought, bring it on.
We decided to proceed with surgery by way of a microvascular decompression of his trigeminal nerve. He was admitted to the hospital. We performed the surgery, which was very straightforward and without complication. He was only in hospital for a few days.
Everybody was absolutely brilliant. The receptionist was very professional, very friendly. Dr. Kenan and his team of brain botherers, it was sorcery, really. They're really nice people who brought me food and drink every day. A young lady who turned up as if by magic, to the second, exactly when I should be taking tablets before I left. You felt like you were the only patient.
From the moment he woke, his pain had gone. He had a pretty seamless journey through the inpatient stay, and indeed, after discharge, he's remained very, very well, and his life has been transformed by the surgery.
I remember a time in intensive care when my wife was at the end of the bed. Two brilliant doctors were there. Kenan turned up and I was just chatting away non-stop. But I wasn't with it enough to realise the significance of what I was doing. It just seemed to come very natural, just like a switch. I can speak again and it's fine. But the little routine things like cleaning your teeth, shaving, moving around, bending down without any pain, that was many weeks before I got used to, with no pain to hit me anymore. And now it's just like normal. It's as though it never happened, really. One of the questions that I asked Kenan was, can you tell me if I'll have any limitations, any long-term effects? And he said, no limitations, do what you like, get on with your life and have fun. And since then we've been marching up and down the dales, we've been swimming, snorkeling, walking 10 miles a day. We've just done everything without any consideration, and it's brilliant. What they can do is magical.